So first, let's throw a few numbers. The supplement industry in the US is enormous, worth more than 60 billion every year, with over 80,000 different products available, and many are marketed for wellness, weight management, or chronic health support. But studies show the risks are climbing. According to the US Drug-Induced Liver Injury Network, the number of liver injuries linked to supplements has tripled from 7% in 2004 to 20% by 2013. And that percentage continues to rise. So something people take for wellness can sometimes lead to the exact opposite, serious liver damage. So let's get specific and let's talk about some of the most popular supplements that may be hurting the liver. And you may recognize some of these from your own kitchen or supplement cabinet. So as I'm about to list supplements that have been implicated in liver injury, I have to reiterate that this does not mean that they are automatically bad or automatically dangerous for everyone. The risk usually arises in three situations. First, when they're taking in excessive amounts, and that's the most common situation. Second, if someone already has underlying liver problems and taking the supplement. And third, in people who are genetically predisposed, such as lacking certain enzymes needed to safely metabolize these compounds. So the first one is turmeric. Turmeric is often praised as the golden spice of health, and it's a great supplement. It's added to smoothies, teas, and capsules, and many people take it for example, joint pain or general inflammation to boost their immune system. But here's the twist. Reports show turmeric can trigger hepatitis, and hepatitis is the medical word for liver inflammation. When the liver gets inflamed, it can't process toxins, fats, or hormones properly. And here are some common symptoms of hepatitis: fatigue, feeling unusually tired or weak, loss of appetite, not wanting to eat, and sometimes with nausea or vomiting. Abdominal pain, especially on the right side where the liver sits. Dark urine, tea or cola-colored, pale or clay-colored stools from reduced bile flow, jaundice, yellowing of the skin and eyes, itching, low-grade fever or flu-like symptoms, sometimes seen early on. So what's more, the risk seems to rise when turmeric is paired with piperine. That's a black pepper extract, which boosts absorption, but also interferes with how the liver handles medications. So instead of being protective, turmeric can sometimes backfire. Number two, green tea extract. Drinking green tea, generally safe. It's great. But concentrated green tea extract, the kind that you find in weight loss pills and detox products, is another story. It contains high levels of catechins like EGCG, and at those doses, the liver essentially gets poisoned. And this can cause hepatitis as well. And in general, think of it this way. Your liver is like a filter. A gentle trickle of green tea is fine, but when you dump a whole flood of concentrated extract into it, the filter clogs and breaks down. Number three, kava. Kava is advertised as a natural relaxant, helping with stress or anxiety. But in some people, kava has been linked to fulminant liver failure. That means that the liver suddenly stops working, and sometimes so badly that the only option is a transplant. Some countries have banned kava because of this risk, but in the US, you can still buy it online. And that's what makes it so dangerous. People think that they're just sipping on this calming herbal tea, but in rare cases, it's a straight path to liver failure. Number